All right, good morning, everyone. Today we are reporting 94 new cases of COVID-19 in the state. This does include 9 new hospitalizations, as well as 3 new deaths, one in a Pennington, one in a Todd, and one in a Yankton County resident. We have 51 newly recovered individuals and 990 new persons who have tested negative for COVID-19. This does bring our total COVID-19 case count in the state to 7,336. Of those, 904 are considered active infections and 6,331 are considered recovered. We do have currently 61 hospitalized individuals, and we've now have 101 total deaths. We have a total of 79,974 total persons who have tested negative for COVID-19. For our community impact map, we have 2 updates. The first is that Fall River County has been elevated to substantial community spread, and that Gerald County has been lowered to minimal to moderate community spread. Our cluster updates for today are for Smithfield Foods. We have no updates to the cluster. For Dakota Ranch Beef, we have 167 recovered individuals out of 170 cases. For LSI Jack Links, we have 122 recovered out of 129. For Dakota Provisions, we have 98 recovered out of 104. And for Avantera Arrowhead, we have 54 recovered out of 67 residents and staff that have tested positive. Our new cases by county include 2 in Beadle, 1 in Bonham, 2 in Brown, 3 in Brule, 5 in Buffalo, 1 in Charles Mix, 2 in Clay, 4 in Coddington, 1 in Davison, 15 in Dewey, 1 in Grant, 1 in Gregory, 1 in Hanson, 3 in Hughes, 1 in Lake, 5 in Lincoln, 5 in Lyman, 1 in McCook, 17 in Minnehaha, 5 in Oglala, Dakota, 10 in Pennington, 2 in Roberts, 1 in Todd, 1 in Turner, 2 in Union, 1 in Yankton, and 1 in Blue-Lock. For the deaths by county, we have totals of 7 in Beadle, 2 in Brown, 3 in Buffalo, 1 in Falk, 1 in Jackson, 1 in Gerald, 1 in Lake, 1 in Lincoln, 1 in Lyman, 1 in McCook, 1 in Meade, 59 in Minnehaha, 18 in Pennington, 2 in Todd, 1 in Union, and 1 in Yankton. The last update I'd like to provide is that for the new dashboard item that was added last week, the total tests by day, we have had a few questions related to that. So we're looking at how we're explaining that to make sure it is clear, and we hope to have it back up on the website very soon.
All right, I'm going to go ahead and unmute our lines, and then we will take your questions.
Hi, Ray from KELOLAND News.
Go ahead, Ray.
Hi, Ray from KELOLAND. Yeah, first of all, Dewey County had quite a jump in, with 15. Can you talk a little bit about the contact tracing related to that? Was it a facility, a family event, or some public event?
So we're still looking. We don't have an update on all of those cases at this point, but we do know that the tribe has been doing some mass testing. And so, we're looking to evaluate whether, it might just be due to a larger number of people who are tested versus, some potential transmission.
Next question.
Thank you.
Mm-hmm.
Yeah, JP from the Rapid City Journal.
We'll go to JP, and then we'll go to the Rapid City Journal.
Thank you very much. Could you give us an update on how the testing is going with the congregate living facilities, please?
Sure. JP, this is Kim Mawson-Rice, and so we are currently working with a variety of congregate living centers and places, and so we have worked with several facilities that provide drug and alcohol services throughout the state, as well as community support providers to people with disabilities. We are working on the larger schedule to help the rest of those facilities get on the schedule, but it is it's going well, and we appreciate the partnership with those facilities.
Do you have any numbers yet?
We don't have numbers yet, JP, but as soon as we do, we will report them out here.
Thank you.
Now we'll go to the Rapid City Journal.
Thank you. Can you talk about schools reopening in the fall, what guidance you're providing on that, and what the case trajectory should look like by August in order to make that decision?
This is Kim Alton-Rice, and I would just let you know that the process that we're using is one of working with the schools on this. We have a group that includes, that is actually being led by the Department of Education as well as the Board of Regents, and includes obviously those agencies, the Department of Health, the Department of Social Services, because we're also looking at child care facilities and what the recommendations are for those facilities. We're currently this week hosting 3 different webinars with different groups to just kind of understand what their questions are, help them understand what the current guidance is. We are awaiting more guidance from the CDC around school reopening and anticipate that any day now. And so kind of as our, as has been the case with many aspects of the COVID response, it does continue to evolve, and we will continue to work with schools so that they've got, good practices and good processes in place.
Next question.
This is Lisa
Callahan.
We'll go to Lisa from the Argus.
Yeah, the numbers have been increasing this week in terms of new cases. Were you expecting that after the July 4th weekend?
Well, I don't necessarily anticipate increases because I do trust that individuals are taking appropriate precautions. But, what I would say is that the cases that we're seeing, we typically do have an increase in number of cases, throughout the week, and then we're a little bit lower over the weekend. So it's unclear whether it might be due a little bit to that. But obviously, with other states seeing increases across the nation, I think we're really focused on trying to make sure that we promptly identify, increases and work with individuals to minimize any potential for spread of COVID-19. With the 4th of July weekend, that did offer opportunities for individuals to come together, either friends, family, and so on. It is a normal time for individuals to get together, and so we do hope that individuals, made sure that they were taking appropriate precautions, while spending time together, and that we'll continue to monitor any increases that we're seeing and trying to identify, how we can best continue to keep COVID-19 at a lower rate in the state of South Dakota.
Next question.
This is Kelly.
This is Jody at Dakota Radio Group in Pierre.
Well, go ahead, Jody.
Thank you. Could you give us an update as far as working with the tribes in the state and how they're doing testing? Are they doing testing at facilities on the reservations, and are those numbers getting included in the numbers the state is reporting? I'm wondering because we heard that the Cheyenne River Reservation is considering a complete lockdown, nobody in, nobody out, because of a recent surge up there. But I don't see a little bit of that is Dewey, but don't see a big surge.
Sure. So, Jody, we are actively working with tribes to support their COVID response, including any testing that they're doing and partnering with them. Usually that has been around providing supplies so that they can conduct mass testing. We have supported efforts in Rosebud, Sisseton, Wahpeton, Yankton Sioux Tribe, Lower Brule, Crow Creek, Standing Rock. We are working with Flandreau. They have not necessarily done mass testing yet, but we've provided some other supplies to them. We've also provided supplies to Oglala Sioux. We also work closely with the Great Plains Tribal Chairman's Health Board, which also supports tribes in these efforts, and we've provided major amounts of PPE to the health board and to tribes directly to kind of help support that aspect of these testing operations. And so feel very good about the partnerships there. We have weekly calls with most tribes and have a separate weekly call with tribal leaders in the state so that, again, we're just, having the best communication we possibly can and helping each other as we can. Just as a note, any positive results and negative results from any testing events, no matter where they're held, are reported to the Department of Health and will be reflected in our numbers.
Okay, and then just a quick follow-up. You listed several tribes there. I did not hear the Cheyenne River tribe as one that has been working with the state as far as getting the testing supplies and things like that. Is that correct?
Sure. So they've gotten support through the Great Plains Tribal Chairman's Health Board, and we know that they've been doing some testing. They have not indicated the need for supplies to the state.
All right,
and what about Crow Creek?
We have supported Crow Creek.
Thank you.
You're welcome.
Then I heard the Yankton Press and Dakotan.
Yeah, I was wondering, the death in Yankton County, can you tell me the gender and age range of that case, if possible?
We do provide information on the number of deaths by county, but due to the potential for the confidentiality constraints, and making sure that individuals not potentially identified, we do not provide the information by age group or by gender for our deaths. We do, as an aggregate on our website, provide that data, but not for individual deaths.
Next question.
Ray from
Ben
Colorado.
Chase with the Plunzman.
Okay, we'll go to Ray, and then we'll go to Ben.
Yeah, thank you. So, can you clarify the potential exposure in Mobridge? We've been told that it was actually the Indian Relay Races event and not the Sitting Bull Stampede where the potential exposure happened. I think if you can email that or that would be great too, because the June 30th through July 1st was the Indian Relay, and the Sitting Bull Stampede was the 2nd through the 4th.
Ray, our understanding from the event organizers is that the entire 5-day event was billed as the Sitting Bull Rodeo and Stampede, so that's how it was identified in the public notice.
Okay. Thank you. Appreciate that.
All right, then we'll go to Ben Chase at the Huron Plainsman.
Yeah, so my question is regarding the test numbers. I realize you guys stated earlier that you removed the test results from the dashboard. One comment that was made last week was in regard to the 5% goal for the month of June being met, and based on the data that was up on that dashboard, that would have been met with 48,000 tests plus. However, that's just tests, that's not people, and people that were tested was right in the range of 36,500. And I'm just curious what the difference is there, because we have, if you're trying to test 5% of the population, that goal wasn't met. And so I'm just curious as to where the goal lies, because 5% of tests is, we could test one person 40,000 times and make that goal.
Yeah. Ben, that's a very good question, and thank you for the opportunity to clarify. So really, when we're talking about 5% of the population, that 5% can be tested across multiple months. So an individual, who is tested in June and tested again in July also counts for both the June and July numbers and getting us to that total. There is the total tests that there is a potential that a person is tested multiple times within a month. But the focus here is that, we do have 5% of the population, and that's, looking at the individual level. The data that's out there, what I would say is that, is all person-centric, and so if you're adding up the total, positive and negative results that happened, that would only give you a certain perspective. We're looking at the total tests that are being done, and making sure that an individual who's tested across multiple months, will count within each of those specific months and counts towards that total population, towards that total 5%. So I think
this is Kim Alston-Rice, and another way to maybe think about it is that the 5% is not a deduplicated number of individuals. And so 5% of the population equals a certain number of tests being completed, but some of those tests might be completed on the same individual given their individual circumstances. Does that help, Ben?
Yeah, to some degree. There's more. I'd like to follow up more on email on that, but
okay. Yep, go ahead and do that, and we're going to work to try to clarify that part too, because I can understand why that could be confusing.
Okay, thank you.
Okay, we'll go with one last question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Some of the other states are seeing testing shortages and delays because they're dealing with surges, and just wondering if you can talk a little bit about testing capacity in South Dakota at this point.
Well, Lisa, I'll just start off here and then look to Dr. Clayton to fill in. We, continue to work on supply chain issues. We recently placed a Panther high throughput machine in Rapid City to be used by Monument Health. That has adequate supply chain associated with it and can run hundreds of tests a day. We've also have on order that will be fulfilled here very shortly 20 additional Abbott ID Now machines, which we will deploy in primarily western South Dakota to help with rally-related needs, and then redeploy to universities to help them as they look to reopen, and the supply chain for those is definitely adequate. We do still run into issues with supply chain around some of the Cepheid machines that many of our clinics have, and so we're actively, continuing to work on that. So I think it's just a matter, it's a thing that we're constantly working on, but again, we're very confident in recommending that, people that should be tested, there should be supply in South Dakota to do that, and we work every day with our partners to make sure that they are accessing those supplies.
And this is Dr. Clayton. What I would say is that, we're looking at a couple different levels of, who is being tested. Obviously, individuals who are symptomatic, those are folks that are getting the tests first, regardless of whether or not they're at higher risk of severe disease. And then we do have, enhanced capability for, as the Secretary mentioned, for conducting mass testing, continue to work on capability for testing within the state, but also do rely on those commercial laboratories out of state.
Okay.
All right.
Jack Cottle, we got time for one more?
Sure.
Jack Cottle, KEBN and KOTA. Are there any numbers at all at this point in terms of testing or positives from the Mount Rushmore event?
So there's nothing that has been identified at this point, but we don't typically speak on in relation to individual cases. What I would say is if there is something related to public notice, that you will see that coming from us. Individuals were very close together, and so it does make it difficult to social distance, and so we would be looking at conducting that investigation, identifying those who are considered close contacts, and if those individuals cannot be named and there are others that are considered close contacts, we would do a public notice.
All right, thank you all for joining us today, and we will visit with you again on Monday.